If someone has no feeling in their feet, or they have peripheral neuropathy, or if someone continually has cold feet.
Did you know that keeping your feet warm is crucial for perfect health? Proper circulation means your feet should be the same temperature as the rest of your body. Discover how simple exercises and an unexpected trick can warm your feet and improve circulation in a surprising way. Get ready to learn a technique that can transform your cold nights into cozy, restorative sleep. The human body has 26 bones in each foot, forming a complex structure that not only supports body weight, but also plays a vital role in overall health, more than you might imagine. Many health professionals, like Dr. Barbara O'Neill, emphasize that proper foot care and alignment can significantly impact your posture, balance, and even organ health due to connections made in reflexology. The condition of your feet can profoundly affect other areas of the body. Issues like fallen arches, plantar fasciitis, or foot misalignment can cause chronic pain that spreads to the knees, hips, and spine, affecting mobility and quality of life. Dr. Barbara O'Neill and other experts stress the importance of keeping your feet in good condition, not just to prevent local pain, but to avoid a cascade of problems that can compromise overall health. Regular foot care, such as wearing proper footwear, stretching, and massage, can be crucial steps in maintaining well-being and preventing major complications. Being and preventing major complications. Dr. Barbara O'Neill explores the principles of reflexology, especially the idea that the feet are a microcosm of the entire body.
Perfect health requires perfect circulation, and perfect circulation means your feet and your hands are warm.
In reflexology, the foot structure is divided into segments corresponding to different parts of the body. By understanding that each segment of the foot is connected to a specific part of the body, reflexology offers a unique way to address health issues holistically. For example, applying pressure to certain areas of the feet can relieve headaches, improve digestion, or even reduce stress. This method, rooted in ancient practices, is valued for its potential to promote balance and harmony in the body without the use of medication. Dr. Barbara O'Neill believes that by incorporating reflexology into your personal care routine, you can not only treat isolated symptoms, but also prevent the onset of new conditions, promoting long-lasting balanced health. The arches of the feet correspond to the digestive organs, and the heels are associated with the lower back and pelvic region. By applying pressure to these specific areas, reflexologists believe they can relieve tension, improve circulation, and support the body's natural healing processes. Dr. O'Neill's recommendation that foot treatments can have significant impacts on overall health is based on the complex connection between the feet and the rest of the body. This theory is grounded in the understanding that the feet contain numerous nerve endings that, when stimulated, send signals through the nervous system to different parts of the body. As these areas are stimulated, you begin to feel a gradual relief from accumulated tensions. This process not only promotes an immediate sense of well-being, but can also have lasting effects on overall health. Regular reflexology practice can help balance the flow of energy in the body, harmonizing the functions of internal organs and systems. Additionally, by reducing stress and tension, reflexology can improve sleep quality, strengthen the immune system, and even increase overall vitality. It is this intrinsic connection between the feet and the rest of the body that makes reflexology such a powerful and holistic approach to maintaining and restoring health. How do you feel about your feet? Research supports the idea that reflexology can alleviate a variety of health issues. Studies indicate that reflexology can help reduce pain, improve sleep quality, and enhance emotional well-being. The accessibility of foot reflexology makes it an attractive option for individuals seeking relief without the need for medications. By stimulating specific points on the feet, this practice can help improve blood circulation, facilitating the delivery of nutrients and oxygen to the body's cells. This not only supports the function of vital organs, but can also speed up injury recovery and strengthen the immune system. Reflexology is also known to help balance energy levels in the body, combating fatigue and increasing vitality. This combination of physical and emotional benefits makes reflexology a powerful holistic approach to maintaining health and well-being. In one of her lectures, Dr. Barbara O'Neill shared an intriguing insight into the effectiveness of onion therapy in treating persistent coughs. Her method involves placing chopped onions on the feet, a practice rooted in traditional medicine. Onions are rich in sulfur compounds and antioxidants, giving them anti-inflammatory and antibacterial properties. This makes them a powerful option for treating respiratory issues. This practice of placing onions on the feet works because the active compounds in the onion are absorbed through the skin, allowing their therapeutic properties to enter the bloodstream and help combat infections and inflammation.
So what you do if someone has cold feet, you cannot do this treatment to them.
It is believed that this technique can help reduce the intensity of a cough and ease breathing during the night, providing almost immediate relief. Additionally, since the feet contain a large number of nerve endings connected to various parts of the body, applying onions to this area can potentially influence the functioning of the respiratory organs. Although it may seem unconventional, this approach is a fascinating example of how traditional methods can complement modern treatments and bring surprising health benefits. Place the onion on the cloth, then wrap it in a bag and position the foot on top of the onion. Next, twist the bag around the foot and put on a sock, ensuring that the sole of the foot is in direct contact with the onion, keeping everything in place. When conventional treatments provided little relief, Dr. O'Neill decided to explore alternative remedies. This unconventional approach quickly showed surprising results. By the next morning, the grandson's persistent cough had significantly subsided, allowing him to enjoy a more peaceful and restorative night's sleep. Dr. O'Neill attributes the treatment's success to the anti-inflammatory and antimicrobial properties of onions, which seem to have helped soothe irritation in the respiratory tract. This simple home remedy highlights the power of natural solutions in situations where traditional methods may fail. Dr. O'Neill's experience serves as a reminder that sometimes the most effective treatments can be found in ancient and natural practices. Our feet are highly porous, allowing the beneficial compounds in onions to be absorbed through the skin and enter the bloodstream, where they can exert their therapeutic effects. Additionally, quercetin, a flavonoid with powerful antioxidant properties, contributes to the benefits of this treatment. Moreover, the sulfur compounds in onions, particularly allicin, offer antimicrobial effects that combat the pathogens responsible for coughs and respiratory infections. Applying onions to the feet can also have a calming effect on the nervous system. Through the absorption of active compounds by the skin, the body not only fights infections, but also promotes a state of relaxation, which is crucial for quick and effective recovery. Dr. O'Neill observed that this approach helped not only to relieve the physical symptoms of the cough, but also to reduce the restlessness and agitation that often accompany respiratory illnesses, providing deeper and more restorative rest for her grandson. This combination of physical relief and mental calm underscored the effectiveness of the treatment, offering a natural and accessible solution to a common problem. If onions aren't enough, you may be surprised to discover how beneficial cayenne pepper can be. Dr. Barbara O'Neill recommends using cayenne pepper compresses on the feet as a natural remedy to improve circulation, especially for those suffering from chronically cold feet.
Because if they have continually cold feet and you put the cold feet in hot water, you can damage the tissues. But
cayenne pepper contains capsaicin, the active compound responsible for its characteristic heat and various health benefits. Cayenne pepper has been widely recognized for its anti-inflammatory and analgesic properties, making it a powerful ally in relieving muscle and joint pain. Capsaicin, by stimulating blood flow, not only warms cold feet but also promotes cellular oxygenation and toxin removal, facilitating recovery and easing accumulated tensions. For individuals with poor circulation, particularly in colder climates, the regular use of cayenne pepper compresses can provide lasting warmth and comfort, significantly improving quality of life. Dr. O'Neill highlights that by incorporating this natural remedy into their routine, patients may experience notable improvements in circulation and overall well-being, all in a simple and accessible way. To prepare a cayenne pepper compress for the feet, cayenne pepper powder is typically mixed with hot water to create a concentrated infusion. The recommended ratio is 1 teaspoon of cayenne pepper for every 2 cups of water, allowing the mixture to steep for a few minutes. Once infused, a cloth or gauze can be soaked in the solution and applied directly to the feet. The heat generated by the cayenne pepper increases local circulation, warming cold extremities and potentially alleviating pain caused by conditions such as peripheral artery disease or Raynaud's phenomenon. People with diabetes or circulatory disorders may particularly benefit from this treatment, as improved circulation can aid in nerve function and overall extremity health. The cayenne pepper compress can also help reduce inflammation and relieve joint stiffness, making it an effective option for those suffering from arthritis or other joint issues. The increased blood flow to the affected areas facilitates the removal of toxins and the delivery of essential nutrients, speeding up the recovery process and promoting healing. To enhance the effects of the compress, you can wrap the feet with a warm cloth or plastic after application, retaining heat for longer and ensuring deeper absorption of the active compounds in the cayenne pepper. This simple home remedy can be a valuable addition to any care routine to improve circulatory health and overall well-being. Maintaining overall foot health is essential, but it's important to monitor how the skin reacts to the cayenne pepper compress, especially in individuals with sensitive skin. Performing a patch test on a small area of the skin before applying the compress can help ensure that no irritation occurs. In addition to improving blood flow, cayenne pepper is rich in antioxidants that combat oxidative stress in the body. This property can contribute to better vascular health by supporting blood vessel function and helping to reduce inflammation. The regular use of cayenne pepper compresses can also help strengthen the feet's resistance to infections and other skin issues. The antimicrobial compounds present in cayenne pepper can act as a natural barrier, protecting the skin from pathogens. This added protection is particularly valuable for individuals who are more prone to developing foot problems, such as those with diabetes or poor circulation. Moreover, Dr. O'Neill emphasizes that these compresses can be especially beneficial.
You can do what I'm about to show you, which is a olive oil and cayenne pepper compress.
After long periods of inactivity, such as during long flights or sedentary workdays. Dr. Barbara O'Neill introduced an intriguing method of garlic absorption through the feet, particularly aimed at babies. This innovative approach involves placing thin slices of garlic on a baby's feet. It is important to note that the garlic should be finely sliced, not grated or crushed, to avoid releasing an excessive amount of juice, which could cause burns or blisters on the baby's delicate skin. Although the feet would recover, this would prevent the use of garlic for approximately a week. Through the skin, the active compounds in garlic can enter the bloodstream, helping to combat infections and naturally strengthen the baby's immune system. When done correctly, this practice can be particularly useful during the winter months when babies are more susceptible to colds and other respiratory illnesses. By applying garlic safely and carefully, parents can explore a natural and complementary approach to supporting their child's health, ensuring that the benefits of garlic are reaped without the risks associated with improper use. Here's a small piece of cloth and 2 thin slices of garlic. Now, Jamie, may I use your hand as an example? Imagine that Jamie's hand is a baby's foot. It's important that the garlic does not directly touch the skin of the foot. So, as I fold the cloth, I fold it once and then again, as you can see, wrapping it carefully around the baby's foot. How many layers of cloth? Just one thin layer of cotton between the garlic and the skin. After that, simply put on a small sock or bootie. Within minutes, you may notice the smell of garlic on the baby's breath because the largest pores in the body are on the soles of the feet. I've used this technique many times and have never had any issues with burning a baby's feet. This simple and effective technique allows the active compounds in garlic to be absorbed through the skin, entering the bloodstream and providing therapeutic benefits without causing discomfort or harm to the baby's delicate skin. Garlic, known for its antimicrobial and anti-inflammatory properties, can help fight infections and naturally strengthen the immune system. The cloth layer between the garlic and the skin serves as an essential barrier, allowing the benefits of garlic to be harnessed while minimizing the risk of irritation. This careful approach is especially important when dealing with babies, ensuring that the treatment is safe and effective. However, I would like to share a recent experience. Just 2 weeks ago, my sister tried this method with her 6-month-old grandson, who had a bad cold. She wanted to do everything perfectly, but instead of slicing the garlic, she crushed it and put it in the cloth before applying it to the baby's feet. Within about 20 minutes, the baby started crying intensely. When they removed the cloth,
Now what I've got is I've got cling wrap down there and I've got a double layer of kitchen paper.
they discovered that the soles of his feet were burned. This incident serves as a reminder of how crucial it is to follow the method correctly to avoid any harm. This simple and effective technique allows the active compounds in garlic to be absorbed through the skin, entering the bloodstream and providing therapeutic benefits without causing discomfort or harm to the baby's delicate skin. Garlic, known for its antimicrobial and anti-inflammatory properties, can help fight infections and naturally strengthen the immune system. The cloth layer between the garlic and the skin serves as an essential barrier, allowing the benefits of garlic to be harnessed while minimizing the risk of irritation. This careful approach is especially important when dealing with babies, ensuring that the treatment is safe and effective. This method is based on the skin's ability to absorb various substances, including the bioactive compounds in garlic, which then enter the bloodstream and produce noticeable therapeutic effects. Garlic, in turn, contains several sulfur-rich compounds, particularly allicin, which is responsible for its characteristic aroma and many of its health benefits. Allicin exhibits antimicrobial, antiviral, and antifungal properties, making garlic a popular natural remedy for various health conditions. When garlic is sliced, allicin is released from the intact cells of the garlic bulb, becoming bioavailable for absorption. Applying sliced garlic to the feet takes advantage of this bioavailability to effectively promote health benefits. The foot, due to its thinner skin and abundance of capillaries, can be a particularly effective area for these compounds to enter the body compared to other parts of the body. The protective barrier, usually made of cloth or a dressing, is used to prevent direct contact between the garlic and the skin, minimizing the risk of irritation while still allowing the active compounds in the garlic to be released. In addition to being an effective route for the absorption of compounds, applying garlic to the feet can have broad therapeutic benefits by leveraging reflexology. In reflexology, it is believed that the feet have pressure points that correspond to different organs and systems in the body. When garlic is applied to the feet, not only are its active compounds absorbed, but it may also stimulate these reflexology points, potentially promoting healing effects in other parts of the body. This combination of direct absorption and reflexological stimulation makes the method even more intriguing for those seeking natural and holistic alternatives to improve overall health. Dr. O'Neill has made anecdotal observations suggesting that when garlic is placed on the feet, it can be detected on the breath, indicating that systemic absorption has occurred. This phenomenon is likely a result of the metabolic processes that occur after absorption. Dr. O'Neill suggests that monitoring the temperature of the feet can provide valuable insights into a person's circulatory and metabolic health. Chronically cold feet, for example, may indicate poor circulation, which, if left untreated, can lead to more serious complications such as heart or vascular problems.
And I'm going to sprinkle it with a little bit of olive oil. You could use castor oil if you like.
She emphasizes that in addition to considering natural interventions, it is crucial that these conditions be evaluated by healthcare professionals to ensure accurate diagnosis and appropriate treatment. Incorporating practices like the use of garlic or cayenne pepper can complement traditional care, but should never replace a comprehensive medical evaluation. Dr. O'Neill highlights that chronically cold feet can be a sign of more serious circulatory issues, such as heart failure or peripheral vascular disease. If untreated, these problems can escalate to more severe complications, including foot ulcers or, in extreme cases, gangrene, which could lead to the need for amputation. She stresses the importance of addressing the underlying cause of cold feet, whether through lifestyle changes such as regular exercise to improve circulation or through targeted medical treatments. Ignoring these signs can lead to significant deterioration in overall health, making early and continuous attention to this condition essential. Dr. O'Neill also emphasizes the importance of considering moisture as an aggravating factor in cases of cold feet. Additionally, she points out the link between cold feet and systemic conditions such as hypothyroidism. When the thyroid is underactive, metabolism slows down and heat production decreases, which can result in constantly cold extremities. People with thyroid dysfunction often report this sensation, highlighting the need for a comprehensive medical evaluation and possibly treatment. Foods like fatty fish, nuts, seeds, and leafy green vegetables help improve blood flow and can combat the effects of cold feet. Additionally, Dr. O'Neill warns against prolonged exposure to cold, recommending that people take preventive measures such as wearing thick socks and using heating pads to avoid cold feet for extended periods. Dr. O'Neill emphasizes that chronic stress can contribute to the constriction of blood vessels, which exacerbates circulation problems and increases the sensation of cold feet. Stress management techniques such as meditation, deep breathing, and relaxation exercises can be extremely beneficial in improving circulation and consequently keeping the feet warm. Incorporating these practices into your daily routine not only promotes foot health, but also supports the overall balance of the body, ensuring more complete and lasting well-being. Conditions like arthritis can significantly benefit from the external use of castor oil. This oil is known for its ability to penetrate deeply into the body, much more than other oils. The recommended use is in the form of a compress, not a poultice, as a thick compress can retain more castor oil and allow for its reuse since it doesn't absorb toxins or waste. The thicker the compress, the more castor oil it can hold, and therefore the greater the amount of oil available for treatment. Initially, you would apply a generous amount of castor oil to the compress and leave it in contact with the skin for a period of time. Ricinoleic acid, present in castor oil, offers therapeutic benefits such as aiding in lymphatic drainage and improving circulation, which contributes to the body's detoxification. In addition to its detoxifying properties, bentonite clay can also help soften and revitalize the skin on the feet, making them smoother and less prone to cracking.
But olive oil will suffice, and you spread it over the area, because what you want to do is put enough olive oil on there so that the cayenne pepper will stick to it.
Regular application of this clay paste not only helps eliminate toxins, but also promotes cellular renewal, improving the appearance and health of the feet. Combining bentonite clay with Epsom salt baths creates a powerful care routine that not only detoxifies, but also rejuvenates the feet, providing lasting relief and comfort. This holistic approach strengthens the connection between foot health and overall health, highlighting the importance of giving careful attention to this often neglected part of the body. Reflexology, which involves applying pressure to specific points on the feet to treat different parts of the body, can also be a powerful tool for improving your health by addressing issues such as digestive problems and hormonal imbalances. Incorporating regular foot treatments into your routine can not only enhance your overall well-being, but also help address specific health issues. By taking time for treatments like foot massages, Epsom salt baths, and reflexology, you not only promote physical health, but also create moments of relaxation and self-care, which are essential for reducing stress and anxiety. These small acts of foot care can serve as a wellness ritual, helping to rebalance the mind and body while relieving the tensions accumulated throughout the day. If this video made you think differently about the importance of foot health and how it impacts your overall well-being, be sure to give it a like and subscribe to the channel. Your support helps us continue bringing valuable content to you. See you in the next video.